This is a story of survival, transformation, and triumph. It is the distance between people and places that is the catalyst for CSL's creation. But it is the extraordinary cooperation by an international community that enables the organization to thrive. For many years, the CSL Story belonged to the Australian people. But today, it belongs to the world.
Ben was at a birthday party and he started saying he felt a little bit sick. He started to slip in the bath and he couldn't sit up. So in that moment, I said, no, I'm taking him to the hospital. He was so happy to get this icy pole. You know, they asked him what flavour he wanted. And he never got to finish it. He said, we've done everything that we can do for him. Now we just have to wait. He said it's up to him.
In the final decades of the 19th century, scientific expertise blooms in the fields of bacteriology and immunology. Luminaries such as Pasteur and von Behring developed defenses against pathogens that have plagued humanity for millennia.
Most of the production was being done in state-owned entities, mainly in Germany and France and in Britain. And then the First World War came along and it disrupted the supply lines of those vital products to the rest of the world. Many countries, and Australia was one of those, decided that they had to become self-sufficient.
It's 1916 when the Australian government establishes the Commonwealth Serum Laboratories to service the health needs of their infant nation. The immediate focus is on the production of tuberculins, followed by a vaccine for smallpox. But their first true test is lurking over the horizon.
The Australian Imperial Force is waiting to come home, but there's no shipping to bring them home. They, like the rest of the armies in Europe, are located in massive camps. This is a perfect environment to spread disease.
As the winter of 1918 approaches, influenza spreads rapidly through the camps and is then transported with the troops throughout Europe, America, and the rest of the world.
How bad was 1918? Scary as hell. People were healthy one day, dead the next.
1/3 of humanity is infected. Tens of millions perish. It's little wonder that when the disease arrives in Australia, there is widespread panic.
Nobody knew what the cause was of this awful disease, but it was thought that vaccines made from bacteria might help to protect the community. And so CSL developed such a vaccine and delivered it to many people.
The people who received the vaccine were far less likely to contract influenza or to die from influenza. And so, although the real cause wasn't known, the secondary effect of these bacteria was the thing that the vaccine was protecting against.
Australia's physical remoteness, an effective maritime quarantine, and CSL's tireless efforts help protect the country from the ravages of the disease. The experience affirms the government's investment in the laboratories and steels the world's resolve to prepare for future outbreaks.
Preparedness for influenza? Preparedness is the absolute key. If you're not prepared, you're going to get caught with your pants down. We've been so close many times.
The inability to identify the real cause of the disease is a major chink in the armour. It's more than a decade after the Spanish flu pandemic that scientists in the UK prove that influenza is a virus.
By putting samples from patients up the noses of ferrets, and the ferrets started to sneeze. And at that point, they knew they had isolated the influenza virus. They grew it then on into other species like mice, and eventually it was adapted to embryonated chicken eggs.
The egg-based production method proves to be remarkably resilient, with CSL and most influenza vaccine manufacturers continuing to use it more than 80 years after the initial discovery. What has changed is the scale. When CSL begins supplying influenza vaccine to Australian and British troops during World War II, they used 20,000 eggs per day. Today, it's close to 1 million eggs each and every day of production. With the identification of its cause and the development of a reliable method for mass production of vaccine, influenza appears to be coming under control. But then in 1946, it's discovered that the virus morphs.
Every year it's mutating and producing little changes that we have to try and keep up with.
And the influenza vaccine is the only one which is updated in this way every year or so.
It's a master of renewal, influenza, and I think we will never control it completely.
Reeling from World War II's unprecedented scale of suffering, the international community creates the United Nations to promote and facilitate cooperation across borders. Shortly after, the World Health Organization is established as the UN's Agency for Public Health. For the first time, humanity has infrastructure capable of coordinating a global resistance against the influenza threat.
And they proposed at the interim commission of the WHO that there should be a surveillance program for influenza to track what was happening with this virus, to learn more about it, so that vaccines could be made that would be protective and would be updated as required.
CSL becomes a WHO reference lab and later a collaborating centre, playing a crucial role in the monitoring of seasonal and pandemic influenza strains. The network does detailed comparisons of viruses from around the world, meeting in Geneva twice yearly to make recommendations for both the Northern and Southern Hemispheres' seasonal vaccines. In addition to producing its own vaccine, CSL also provides an essential service for other vaccine manufacturers.
By producing the seed viruses from which the vaccine will ultimately be made, and it does that for WHO and shares its seed viruses with other manufacturers.
With each of the global pandemics that follow the Spanish flu, CSL proves the effectiveness of its preparation, while the steady transition to a globalized world increases the speed at which contagions spread. This is mitigated by continual improvements in diagnostics, communications, and vaccine manufacturing capability. And overall, it seems the trend is towards a diminishing impact. But a repeat of the horrors of 1918 is entirely possible at any time, should an unexpected mutation emerge in conditions that circumvent our defences.
Health experts have moved closer to declaring the first flu pandemic in 40 years.
Very similar to the 1918 influenza. Scarily so. From a molecular point of view and a structural point of view, they were essentially identical.
Armed police are guarding Mexico City's hospitals, reportedly turning people away.
It wasn't what we were expecting. All the planning had been for an avian flu.
Based on the pattern of illness that we're seeing here in the United States, we don't think that this virus can be contained.
It was here before we knew it. It was spreading before we knew it.
It really is all of humanity that is under threat during a pandemic.
He was on the life support machine. So that machine was breathing for him.
As soon as this became an issue of concern, we were talking to CSL about what was needed. The fear you have with pandemic is that it will get worse, that the virus will mutate, and that many people will die before you can actually roll out a vaccine.
They explained that in a small percentage of people, the body reacts by killing the flu virus, but then it doesn't know when to stop, so it starts to attack the brain stem. If there'd been a vaccine available, we would have definitely had him vaccinated and had all of our family vaccinated.
And then, the breakthrough. A vaccine emerges from the global community of scientists, and CSL's production expertise ensures Australia is one of the first nations to provide this protection to the public.
I can still see the meeting that we had where the data were put in front of us to show that we got the reaction we wanted. People were just really, really thrilled. It was one of those very good moments in health and in science.
2009 could have turned out very, very differently.
We do consider ourselves very lucky that he has been only left with a sort of mild left-sided weakness, which means that he goes through a lot of left shoes quicker than his right.
When we're thinking forward, where will the next influenza virus come from? If it's a repeat of a virus that's been in the human population previously, the result may be similar to 2009. If it's a virus like the H5N1 or the H7N9 viruses that are currently circulating in other parts of the world with a very high mortality rate, around 50% of the infected people die, it could be a very different story.
In the wake of the crisis, CSL's flu business arrives at a crossroads. While pandemic response offers a spike in sales, the industry's slim profit margins demand a major investment in scale to compete. And with new technologies threatening to make its flu products obsolete, CSL is forced to consider divestment or risk slow death. Before we explore the decision, there's a lot more we need to understand about CSL's story. It's the early 1920s, and a great sense of shared purpose drives CSL to broaden its portfolio of medicines. Hard work is tempered by lunchtime dances, tennis games, and the odd fox hunt. While research is not a mandated priority, staff constantly innovate to improve quality, yield, and speed of production. Soon, there are CSL vaccines for typhoid, diphtheria, pertussis, and tetanus. But it's an exciting new scientific breakthrough from a team at the University of Toronto that showcases CSL's growing international reputation for quality production.
This man is one of our people. He's not a butcher or a chef, but he spends all of his time instructing abattoir staff on how to remove the pancreas glands from cattle and pigs after slaughter. These glands are the sole source of the insulin, which is used to control diabetes.
Prior to the availability of insulin, diabetes was a death sentence. People didn't suffer from diabetes, they died of diabetes.
Incorrect dosage or poor purity could have a devastating impact on patients and compromise the reputation of the product. So the production rights holders take no risks in assigning licenses. They choose just 4 organizations around the world. CSL is one of them. Making the latest medical breakthroughs available to the Australian people becomes a trademark of the organization, and insulin production remains a cornerstone of CSL's expertise for the next 60 years.
And the demand for the product is growing as more and more diabetes is being diagnosed and diabetics are living longer because of insulin.
In the early 1900s, agriculture is the backbone of the Australian economy, so protecting animal health becomes a significant focus for CSL. Black disease has been wreaking havoc in the nation's sheep flocks before a vaccine is invented by the Australian government's premier research organisation, the CSIRO. CSL translates the scientific breakthrough into practical outcomes, manufacturing large quantities and reducing the disease to negligible levels. It's 1928, and returning from his summer holiday, Alexander Fleming discovers mold has grown on a petri dish. Subsequent experiments prove the power of the substance to fight bacterial infections. But in order to treat infection in humans, he must discover how to isolate the active ingredient and produce sufficient quantities. Eventually, with one of the greatest discoveries in history at his fingertips, but without the financing or production expertise to continue, Fleming abandons penicillin. Through the 1930s, an economic depression hastens a return to war, in turn stimulating scientific endeavour that might offer the combatants an advantage. The dormant treasure of penicillin piques the interest of the Australian Howard Florey and his German collaborator Ernst Chain. Together, they set about resolving the issues that had thwarted Fleming. They managed to isolate the active ingredient in their lab and then apply the production expertise of beer manufacturers to help grow sufficient quantities. With the code cracked, the wonder drug is made available to Allied forces in time for the D-Day landings. On the other side of the world, a former CSL employee named Val Baisley is on active duty in the jungles of Papua New Guinea. He is deployed to America to learn the penicillin production process before returning to CSL. Seen here, Baisley's handwritten notes provide the foundation for CSL's remarkable production success, enabling Australia to become the first nation to make penicillin available to its civilian population.
Within 6 weeks of arriving back in Australia, Baisley had produced the first dose of penicillin, which was shipped up to Papua New Guinea and saved the life of an Australian soldier dying of sepsis. Within 10 weeks, he'd produced several 100,000 doses, which could also be used in civilians.
He worked like a dog, and the people around him worked like dogs, because every one of them understood that what they were doing was of national importance.
It's a truly extraordinary Herculean effort. The situation for vaccine manufacturers changed dramatically after the Second World War, because with the development of penicillin, it became possible to maintain living cells in culture and therefore to isolate a whole range of viruses. And there was a tremendous wave of new vaccine development during that period of time.
One disease that continues to elude science, despite enormous investment, is poliomyelitis. Highly visible and life-threatening in severe cases, the dreaded polio can leave bodies crippled and the community paralysed by fear.
Social events were either cancelled or curtailed. All the schools were closed.
There was no effective treatment. If you were paralysed, you remained paralysed.
My parents, like the whole of the rest of the community, were so terrified that I was sent off to live on an isolated farm with absolutely no contact with anybody other than the owner of the farm.
When I was at Fairfield, we had a whole ward full of people in iron lungs who'd acquired their infection in the 1950s and spent the rest of their lives with artificial respiration.
Fresh from the success of penicillin, CSL's Val Baisley travels to America, where he takes up a position as lab manager for a little-known scientist named Jonas Salk. By growing the poliovirus in animal tissues, the team unlock an extraordinary breakthrough and are soon able to deliver a vaccine to a desperate world.
The world went crazy. There was nothing short of hysteria. It was comparable to the impact that it would have today if someone announced a cure for cancer.
There was a sense of joy, and people like Baisley became national heroes because the fear had been so great.
With the vaccine in hand, the response of CSL and the Australian government is swift, decisive, and brilliantly effective.
This boy is like thousands of others throughout Australia who have been made safe from polio, and it doesn't hurt a bit. The millions of doses are the first step in the immunization campaign now well underway, which means that another disease is coming under control.
25 million doses are administered to the public, and by the late 60s, the disease within Australia is effectively consigned to the annals of history and the memories of those who lived through it. Making international breakthroughs rapidly available to the Australian people put CSL at the heart of the great public health campaigns of the 20th century. But the times are changing, and the relationships between governments, corporations, and the people are being transformed by free market forces. Within a decade of their heroic polio blitz, CSL's vaccine is rendered obsolete by superior technologies, and both insulin and penicillin are on the same trajectory.
The multinational companies were able to manufacture on a scale that we couldn't even dream of. And the penicillin that came from those plants was sold in Australia for less than CSL could buy an empty bottle.
With the loss of these products, the organisation faces a crisis of identity. But in another area within the Parkville complex, the seeds of the organisation's future are already beginning to sprout.
Of all the rapidly expanding fields of medicine, blood component therapy must be considered one of the most significant to both the medical profession and to the public at large.
It has been said, perhaps unfairly, that some doctors order blood components from their blood bank as if they were buying milk from the local store. But the preparation of the human product is, to say the least, rather more involved than the bovine.
In Australia, these processes are carried out by the Commonwealth Serum Laboratories.
It's World War II, and CSL works with the Red Cross to identify the blood type of every Australian Army recruit. In the bloodiest conflict in human history, this insight could mean the difference between survival or the alternative. But the ability to transfuse wounded servicemen is greatly limited by the difficulty in storing blood. To this end, Edwin Cohn and his team at Harvard focus on a breakthrough in the fractionation of blood. The aim is to isolate albumin, the key protein required to treat hemorrhagic shock, and to supply this in a dry form that can be reconstituted where and when required on the battlefield.
There is no question that the requirements of World War II increased the urgency of developing the cone fractionation. From an academic point of view, there was really no purpose in cone fractionation, but it was immensely important for transfusion technology.
Essentially what it is using salt and solvents to fractionate proteins that have different solubilities.
Before then, it was simply a matter of volume. You could not get enough protein into an individual to be therapeutically useful because you had to put in all the plasma. Here you just put in a small portion.
Central to the success of the technique is Armour Pharmaceutical, who industrializes Cohn's science and becomes the major supplier of albumin to the American military during World War II. Along with Beringwerke in Germany and ZLB in Switzerland, they helped to create a worldwide plasma products industry post-war. 50 years later, all three organizations will integrate into the CSL network. But in the meantime, there's an industry to build. Albumin is just one of 2,000 plasma proteins, many of which have potential medical uses. As Cohn's technology is refined, the ability to separate these proteins improves, enabling expanding portfolios of life-saving and life-changing products. To develop these therapies, there's a need for an ample, healthy supply of human plasma. And from the early 1950s, CSL relies on the Red Cross for collection in Australia. Funded by the government, this system delivers treatment to patients free of charge. It isn't long before Christmas 1952 when CSL releases the first of their plasma products, an immunoglobulin.
Immunoglobulins comprises the antibody proteins present in plasma. These antibodies are usually administered to provide temporary passive protection to persons exposed to certain diseases.
As the science, production expertise, and delivery systems evolve, more proteins are purified, and many rare inherited diseases become treatable.
Immunoglobulin was available at the time albumin was, I guess, first discovered, but it wasn't in a form where you could give large volumes to people intravenously. And so it was tended to be given intramuscularly, which was quite painful.
1979, we introduced into the global markets the first intravenous immunoglobulin.
And that meant that very large volumes of immunoglobulin could then be given to patients. And so people who are born with poor immune systems, largely they don't make antibodies or immunoglobulin, they could then be topped up on a regular basis.
I was diagnosed with common variable immune deficiency, and that is one of 200 diseases under the umbrella of primary immune deficiency. Now, primary immune deficiency is already rare, but when you break that out into 200 diseases, then it really becomes rare.
The next group of plasma protein fractions is the coagulants. And these come in three principal concentrates for the treatment of coagulation deficiencies.
Coagulation factors control the bleeding, if you like, in our bodies. And some kids, unfortunately, are born with deficiencies in these products. Factor 8 and factor 9 are two common ones.
In Germany, Beringwerker leads the world in development and production of coagulant products to treat life-threatening diseases such as hemophilia.
This site here had a leadership position in developing plasma fractionation, purification, separation of proteins, describing certain proteins for the first time and turning them into commercial products.
Beringwerker also pioneers the use of pasteurization to kill blood-borne viruses, which will prove invaluable in the fight against an emerging threat. In 1981, America becomes the first country to officially recognize an alarming new disease.
In those days, it was called the gay-related infectious disease, or GRID. And we thought that it was a kind of a medical curiosity, but within a year or so, it was clear that this was going to be something that would transform all of our lives.
By 1983, extreme fear surrounds the disease, now known as HIV/AIDS, when it's discovered that the transmissible agent is primarily spread by blood.
The numbers of people infected were doubling every few weeks or so, and there was a genuine fear by many people that we would truly have a pandemic and that everybody was at risk.
Among those who are at significant risk are patients using plasma products. The entire industry is under intense scrutiny. CSL experiments with heat treatment during fractionation. The approach proves effective at inactivating the virus, helping to stabilize the crisis and protect patients. The HIV/AIDS epidemic has a significant influence on the government's decision to invest in a new state-of-the-art fractionation plant at CSL's site in Broadmeadows.
Broadmeadows was a way to go from being backward to state-of-the-art.
CSL commits to the use of chromatography technology instead of cone fractionation.
Implementation of this technology is great for people like me to do in the laboratory. It is a totally different thing to implement this in the factory.
While chromatography has been around since the 1970s, it has never been successfully developed on an industrial scale. Other companies have tried and failed, so the decision carries a significant risk.
We were totally committed and we had to make it work. We knew we'd done it in pilot scale, so we knew we'd do it again.
The first 3 batches failed, and it was quite a tense period. Essentially, the product, albumin, cleaned the new pipes, the stainless steel pipes, better than all the cleaning solutions that we used at the time. And so we were getting iron contamination. Thankfully, that disappeared by the 4th batch.
The reward for all this risk is extraordinarily pure product and an enormous production capacity. Mastering the technology also arms the team with knowledge, skills and confidence to drive CSL's global expansion, helping to transform the much larger businesses they begin to acquire. ZLB, based in Switzerland, is one of the largest producers of plasma products in the world, best known for its immunoglobulins. Nabi, based in the US, is a nationwide network of plasma collection centers. And Aventis Behring, comprising the former Behring worker in Germany and Armour in the US, is an industry leader in coagulants and commercialization. In each new facility, CSL's innovations optimize efficiency, and the results are clear. Underperforming operations begin to thrive, and today, this globally integrated network generates 90% of CSL's revenues. Much of this commercial success is due to the launch of new products Privigen and Hizentra, liquid immunoglobulins able to be stored at room temperature. Privigen is conceived in the labs of Bern and draws on the chromatography technology in Broadmeadows. It's executed as one of the first major collaborations after CSL's acquisition.
In CSL's history, it was the first product to reach $1 billion of sales in 1 year. We also saw that intravenous application always needs the patients to go to the doctor, to stay in an ambulatory setting. And we thought, can't we do something for these patients?
So that was the moment when the subcutaneous Hizentra actually was born.
I'm now actually on a product called Hizentra. I do my own treatment at home. I do 4 needles in my stomach, and it takes me about 3 hours. That's just a little bit of an inconvenience compared to what it was when I started, because the IVs were like 9 hours.
The source plasma that CSL Plasma collects here in the United States is used by all of the CSL Behring fractionation facilities across the globe.
6,500 staff collect plasma from a growing network of donors in the US and Germany.
Many of them, more than you might think, actually have a personal connection. They know somebody that uses the drugs that we manufacture. There's a pretty good percentage of our employees that are also donors.
I had been working with my husband for 20 years in our own firm when the recession hit. I took a contract position at CSL. It was thriving in a time where our company was just dead. A manager had approached me, and I said, you know, geez, I don't know anything about plasma. I don't know anything about the medical field. And he said to me, Ty, if you really want to learn the business, go donate. First time I went to the center, and I sat in the parking lot for a half an hour and left. So I went back, my husband came with me. It became easier to donate, and I tried to donate twice a week. It's been about 3 years now.
I am on one of the drugs that your company produces, and it is a lifesaver for me.
Each one of our centers in the U.S. is connected with a patient who takes our drugs so that they really get firsthand knowledge of what kinds of conditions people have that might require these pharmaceuticals.
I told my husband, gosh, I only had pneumonia once this year. Can you believe that? I mean, there's constant improvement in my life I can see from year to year.
Recombinant DNA technology represents a new era for the protein products industry. The acquisition of Aventis Behring brings with it exciting science in recombinant coagulation factors, and the purchase of Zenith Therapeutics 2 years later deepens the capabilities and talent of CSL's global R&D team.
As a company who manufactures plasma-derived product, it was basically the logical next step of the evolution. So the recombinant technology allows you to generate improved molecules with new properties and which clearly can benefit the patients.
So for example, with our most recent product, Idelvion, we've modified that protein so that it has an extended half-life. What that means is that patients who have been, say, treating themselves prophylactically by injecting maybe 2 or 3 times a week can, moving forward, treat themselves probably once every 2 weeks.
Our clear plan and intention is to license for the first time both our Factor 9 and our Factor 8 recombinant products in the US and Europe and, of course, other important parts of the world.
You know, we had great history in vaccines, and then you had the plasma business. But now all of a sudden, we've got a third leg that we can stand on. And Idelvion and Astilla, and hopefully after that Factor 7, are really showing the world that CSL is the organisation that has the talent to do that.
Plasma protein products are now the breadwinners for CSL, filling the void left by the mass public health products of the 20th century and fueling the transition from government-owned domestic manufacturer to a thriving global pioneer. Merely recounting the milestones can make this path to success seem obvious or even inevitable. But the reinvention of the organization required a bold vision, courage, and the determination to overcome resistance to change. How it did so is quite a tale. With the success of penicillin still fresh, and having recently conquered polio, the CSL of the late 1950s receives the admiration of a grateful public and the esteem of the scientific and medical communities. But despite being dutiful in delivering on its public health mandate, the organization is financially unsustainable. Rumors begin to spread. Newspapers report that the government is considering the sale of CSL to private pharmaceutical companies. Outrage ensues.
Arthur Caldwell said of the approach to buy CSL that if the government of the day agreed to it, it would be an act of criminal folly so great that it would cost the government leadership of the country.
Sale negotiations dissolve, but in 1961, new legislation demands that CSL operates along commercial lines. Hero of the penicillin and polio campaigns, Val Baisley, has risen to the top job. But his outspoken resistance to the new commercial imperatives leads to his suspension. And the tensions of profit versus public health weigh heavily on the organisation for the next 30 years.
We were expected to hold our end up and to operate profitably and to operate efficiently.
But while we had the government as a single shareholder, we were never really going to be commercially focused. I joined mid-60s. They were starting up a sales force. They were absolutely bloody hopeless, had no idea about commercial aspects. The scientific side sort of looked down their noses a little bit at this newly found commercial group.
A suspicion of profit motives isn't surprising in a culture closely aligned with academia on the one hand and the public service on the other. Nor is it hard to understand that as society changes at an unprecedented pace, people cling to their traditional attitudes.
I first heard about Miss CSL competition probably early in 1969. I was nominated by the maintenance department and I won, which was even more surprising. The prize was donated by CSL. I took my mother for a week in Surfers Paradise and I can't believe that it was actually me that did it. And it was Miss CSL, and still Miss CSL.
And then the world changes.
That's one small step for man, one giant leap for mankind.
Great scientific advancements in the wider society are not reflected within CSL. There's a broad array of research under notions of national interest, but no overarching strategy. And the hard-won respect of the scientific and medical communities is dissolving.
We were just not keeping up with the science. And it was a recipe for extinction.
There are no great public health campaigns to ignite morale and feed the coffers. The development of new products is being driven away from the public sector and into private enterprise as the cost, time, and increased regulation become investment risks that are too high for governments. Production of the polio vaccine ceases, and CSL's competitors are beginning to innovate them out of both the penicillin and insulin markets. In 1974, the organization comes within a month of being unable to pay wages.
Collapse,
asphyxiate,
swelling and blistering,
catastrophic bleed,
headache, nausea, vomiting.
Causes the heart to stop beating.
There's no doubt that thousands of people in Australia over the last 80 years owe their lives to the use of CSL antivenom.
Despite the malaise, there are occasional victories that remind staff of the glory days. Since the 1930s, CSL has delivered life-saving antivenoms to treat the bites and stings of Australia's deadly creatures, including tiger snakes, taipans, redback spiders, and stonefish. But a breakthrough for the funnel web spider has proved a deadly frustration.
Unlike most of the snake venoms, the funnel web spider venom has a very particular effect on our nervous system that you don't see when you inject that into mice or rabbits or guinea pigs.
But you have to have an animal model, unfortunately, to be able to test an antivenom.
The puzzle is solved, as it often is, in a moment of serendipity. CSL's research team, led by Struan Sutherland, discover that day-old mice are susceptible to the funnel web's venom. It's taken 80 years to reveal this insight, so CSL doesn't waste a minute translating it into production. But antivenoms barely turn a profit, and while many Australians will now survive thanks to this breakthrough, it won't help much in keeping CSL alive. The Animal Health Division is the one area of the organisation that is thriving commercially. Their innovation and success sustains the broader cause and offers a model for the future should CSL survive this difficult period. But as similar organisations around the world are being sold off or shut down, that appears unlikely.
The mechanisms for being a vibrant pharmaceutical company no longer existed.
It's 1983. Fierce debate rages throughout the Western world over the privatisation of state-owned assets. Bob Hawke, the former union leader and freshly elected Prime Minister of Australia, arrives at CSL to open a building named in honour of the great Val Baisley, public health warrior and resistance leader against the government's commercialisation process.
I give you the employees of CSL a guarantee, and I give the people of Australia a guarantee. It's very appropriate that it be given today. CSL will not be sold off to private enterprise.
At a rare, full-scale news conference, Mr Hawke, for the first time, clearly defined his privatisation shopping list.
One, in a sense, needs to look at Qantas, one needs to look at the Commonwealth Bank. Perhaps one needs also to look at Commonwealth Serum Laboratories.
The government had looked at it and decided that rather than close it down, there was possibly an opportunity for it to grow if it was left on its own.
I mean, what the government wanted to see achieved
was an economy that focused on doing some new things or old things in new ways, and it needed to, rather than being inward-looking, we needed an economy that was outward-looking and was looking to be competitive on the global scale.
Transformational change needs a disruptive, ambitious leader, and CSL finds its man in Dr. Brian McNamee.
The company had been under the dead hand of government, and the end result was a hollowed-out organisation that had very little future. We had to change.
Well, I think that I have a very clear charter to make CSL a commercially relevant organisation.
We needed to become efficient, and that meant downsizing, but downsizing was so we would create more money for research and development. We were trying to create margin so we could invest more in our future.
In its 75th year, after decades of threats and promises, the government takes the first steps to setting CSL free by incorporating it as a public company, with the government remaining the sole shareholder for now. Meanwhile, the young CEO's vision of an innovation-driven future needs an R&D leader who commands the scientific respect lost in recent decades. That man is Ian Gust.
He had a vision and a dream, and I found it compelling, albeit one of extremely high risk.
After culling many projects and clarifying their strategy, the R&D team seek out Australian researchers doing world-leading work into vaccine-preventable diseases that have both a commercial and a public health value. On a very short list are the words Ian Fraser, human papillomavirus.
To get Ian into the fold, I needed a few $100,000 initially. So I decided to ring Brian. He just said, do it. We'll find the money. So I did it, and he found the money.
More than a decade later, that project becomes Gardasil, an extraordinary medical and commercial success around the world, now protecting both men and women against HPV and related cancers, and earning CSL royalties of more than $1 billion since its launch in 2006.
What's your greatest fear for the future of CSL?
The disappearance of this organisation or its total domination by a foreign-owned multinational.
In the 1993 budget, the government announces that CSL will be sold as a trade sale.
So the view of Canberra was the organisation had very limited future and in fact should be sold through a trade sale, which really meant the dismemberment of the organisation. It was our one chance to take control of our destiny. So I, with John Button, spent a lot of time persuading, first of all, government that we had a future and that the best future was through an IPO on the ASX.
CSL had enormous potential, and I think certainly Brian convinced me that it wasn't going to be realised unless we freed it up to operate on a very different basis.
Not only does the government relent to an initial public offering, thereby keeping the company intact, they also agree to sell to CSL the partially built fractionation facility at Broadmeadows, which is facing lengthy delays and cost blowouts. This is a truly defining moment in the CSL story. Ownership of Broadmeadows is a huge boost to the company's IPO listing value. And in a great blessing that will only become apparent with the passage of time, it also binds the company's future to plasma. The success of an independent CSL is pinned to the success of Broadmeadows and the empire that will emerge from its stainless steel tanks. When CSL lists on the Australian Stock Exchange, the company has survived multiple near-death experiences to earn the freedom to chart its own future. But the hard work is only just beginning.
I kept saying to the staff, the future for our business is North America, and it is through innovation and new products. It's not about the past, it's about what we can do in the big markets of the world.
The reality was that the organisation was strategically vulnerable. We were predominantly an Australian-based business at that time.
We had to get smarter, we had to get better, we had to get bigger.
Shortly after privatisation, CSL acquires a cell culture business based in Kansas City, and later an animal health business in Nebraska. These relatively modest transactions enable the team to learn the challenges of international acquisitions. Meanwhile, early success of the Broadmeadows facility inspires a daring plan with game-changing rewards.
Peter Turner and many of the fine engineers there developed a lot of novel processes that we could almost lead the world in modern fractionation. So for the first time, we had a card to play.
ZLB, one of the largest producers of plasma products in the world, is being sold by the Swiss Red Cross. The American Red Cross invites CSL to enter a joint bid. At the 11th hour, the Americans withdraw. But CSL holds its nerve and proceeds alone, joining a three-way bidding process.
Novartis was well known, Asclear was a local company, and there was CSL. Nobody knew them. In that process, it became known that the CEO of CSL, Brian McNamee, he was seriously sick, but he was so determined that he jumped in a plane, came to Bern, he convinced the Swiss Red Cross to sell to CSL. And I think that was something that people still today talk about, this determination.
A small, technically strong Australian company could persuade the Swiss Red Cross that we would be a fine custodian of this very important asset, a business that was much bigger than us in plasma fractionation. That was the moment that really transformed CSL.
Through ZLB Bioplasma AG, our wholly owned subsidiary based at Bern in Switzerland, we produce intravenous immunoglobulin for the USA, the world's largest market for plasma products.
To secure supply of plasma to this growing manufacturing network, CSL needs a donor collection solution.
If we wanted to grow in the global market, it was realized we need our own raw material supply. And so that was the time when we acquired the Nabi centers.
The deal is sealed in June of 2001, and 3 months later, the integration begins.
They brought all of the employees together for a meeting here in South Florida, including the managers from the plasma centers that were a part of the Nabi group.
And we just kicked off the meeting at 9 a.m.
when all of a sudden cell phones began ringing all across the room. It was a real opportunity for us to see how CSL was going to treat us as people and employees. They made sure that people were taken care of, were able to communicate with their families back home, and really took care of us on a human level on that first day.
As a publicly listed company, the market offers a regular scorecard for CSL's performance. The purchase of Nabi is warmly received, and the share price soars. But a glut in global plasma supply soon delivers a harsh reality check.
CSL down 12% to $17.87 following a profit downgrade because of lower prices for its products. The shares are now a third of what they were at the start of the year.
The battered share price leaves the company vulnerable to being bought and split up. But CSL's typically bold response is to expand. Aventis Bearing is a major player in the global plasma industry, with manufacturing sites that include the Kankakee facility, previously operated by Armour, and the Marburg facility founded as Bearing Worker. CSL launches an audacious acquisition bid and wins.
CSL to us was an unknown entity. We were used to the major players within the plasma industry, but we'd never really heard of CSL.
I think the board had a lot of courage in buying another
large business, 3 times bigger than what we were, doubling their bets effectively.
Both companies were struggling at that time. It was really a combination of, this has to work for that part of the industry to survive.
With Aventus Bearing failing to generate positive cash flow, tough decisions have to be made.
Then they started downsizing, and I thought, okay, they're trying to get rid of the company total. That was my first reaction.
It was either do that or shut some of the operations.
In Kankakee, there may be no choice in the matter, with an FDA consent decree likely to shut the entire operation. These are issued after repeated violations of good manufacturing practice and force companies to change the way they operate. Most fail to do so.
Kankakee facility is a significant employer and contributor to the Kankakee area. So the thought of having a consent decree reduce or eliminate the business there was critical.
CSL sets about overhauling their entire supply chain. Local strengths are harnessed to make each facility not only sustainable, but a center of excellence in CSL's global network. Efficiencies are driven through innovation in plasma collection, production, and logistics, while the most is made of existing products. This re-engineering not only rescues the Kankakee facility, it transforms the economics of the entire sector. CSL, the follower, has become the pioneering industry leader.
Right from the day we took over, things started to turn up. And that was incredible to live through.
It was the most focused group of individuals I ever met in terms of making sure that this business was successful.
To be quite honest with you, no, I did not think we would get out of a consent decree. In fact, if you ever look around, I believe this is only maybe the second company that has ever got out of one. And I keep telling my employees, I said, you don't want to go back.
With both the Kankakee and Marburg facilities thriving, many of the laid-off workers return.
The sites that were dramatically affected are now 2 or 3 times what they were when we first went there and took over the business.
During this period, CSL remains committed to a focused strategy, being willing to divest quality assets in service of the bigger vision. Another critical success factor is the understanding that acquiring a company and integrating their culture are 2 very different things.
This transition phase of changing ownership through the Australian was very difficult for us, for the employees.
Made mistakes, things went wrong. We learned a lot about cultural differences.
So many of us left. There was a lot of anxiety.
Do they really understand who we are and what we're all about?
What does transcend cultural difference is a shared devotion to patients and dedication to science. The teams bind through respectful collaboration, utilizing one another's strengths to create something new together.
As you really have teams that work together on special projects, you grow together.
When CSL acquires Melbourne-based Zenith Therapeutics, that team is partnered with Marburg to develop recombinant coagulation factors.
The recombinant programs are particularly important for Marburg. The original discovery research was done here.
But without the collaboration with the CSL group, we would still stuck there. So it was very important that we got them involved, and so we could really start the development of these products.
Well, one of the strongest performances in the recent reporting season was the global plasma and vaccine business, CSL. Now, having bedded down the $100 million acquisition of the Melbourne-based biotech business Zenith late last year, and with royalties from its blockbuster cervical cancer vaccine Gardasil starting to flow in, the company looks to be moving away from its reliance on the commodity of plasma, which accounts for about 90% of the business still.
While the focus has been on the great expansion of the plasma business, CSL has been left behind in the flu space, with its rivals developing technologies that threaten to make its products obsolete. Recalling the fate of its polio vaccine, insulin and penicillin, CSL faces a tough choice: invest heavily or exit the game.
And I think it'd be fair to say that we either neglected or perhaps didn't put the right amount of attention onto the influenza business through that time period.
Mexico, meanwhile, is burying its dead, and the United States has been told it may have to do the same. As the outbreak spreads across the Americas, the White House has asked Congress for $2 billion to fight the disease.
While CSL is considering its future in the flu industry, the US government and Novartis open a cutting-edge influenza vaccine facility in Holly Springs to ensure pandemic preparedness for America. With characteristic shrewdness, CSL acquire Novartis's flu business, including the Holly Springs site and a major production facility in Liverpool, England.
We hold a number of pandemic contracts with the UK, with Sweden and with Switzerland as well.
The investment also buys some exciting science, such as an adjuvanted vaccine and cell culture technology, the first major evolution in vaccine production since the introduction of chicken eggs in the 1930s. The integrated business is the world's second largest flu vaccine provider, rebranded as Securus.
We're well placed to ultimately bring the CSL approach to that business to ultimately take it to global leadership.
The Novartis flu business acquisition provides a poetic bookend to the last 25 years of global expansion, and indeed, the entire centenary story. The CSL that confronted Spanish flu on behalf of an infant nation now extends pandemic protection through North America, Europe, and the Asia-Pacific. And the 20 people in a small government department has grown to a workforce of over 16,000 staff, with a presence in more than 30 countries.
For all of us who sat round the original executive table in the early 1990s, we could not have dreamed where CSL would be today.
We never set out to create this giant of a company that we have today. That was never the objective. The objective was to give the organisation a future, not a past, and to think about the patients and how we could match great science to the patients.
As CSL approaches its centenary, the president of the plasma business, Paul Perreault, takes over from Brian McNamee as CEO of the entire CSL group.
If you're going up the mountain and you're going up the curve, at some point, if you reach the top, the only way to go is down. And so you constantly have to reinvent yourself. You have to come back down the mountain a little bit and say, okay, I think we're here. How can we, reinvent and come back again and grow?
The share market is perhaps the least sentimental judge of CSL's performance. But more emotionally invested are the staff members, who each received a gift of shares when the company listed in 1994.
Well, when our marriage split up, I had to get a job. I had 2 boys to bring up. So I had to clean the canteen, the theatre, the toilets. Oh yeah, we had some fun. I checked the shares fairly often, at least a couple of times a week. I always thought when it got to $50 I'd sell, but I didn't. And then when it got to $100, I thought I'll sell. I'm keeping the shares, well, in case I really need something, but I'd like to have something to give me family when I'm gone.
With dividend reinvestment, $1,000 invested in 1994 is worth over $200,000 today.
Well, they often say to me, oh, when the old girl goes, we'll be right. But they mightn't be right. I'm going to live for a lot longer. There mightn't be any shares left.
The work of the laboratories has no end. Solving one problem means time and opportunity to tackle the next. The research section is investigating diseases from influenza to cancer. It is slow work because it must be sure. Lives depend on these eyes and brains, the skill of these fingers, the observations made, the deductions drawn. Check and cross-check. There must be no possibility of final error in work where a mistake can mean death.
I think imagination and creativity are really the key ingredients in a great scientist.
The ability of one to look at a problem and see not what it is, but what it could be, what opportunities are out there.
Imagination is absolutely critical and necessary, but not sufficient for doing great science.
Being able to see the gaps in knowledge, but also being able to understand which of those gaps is capable of being filled.
It has to be combined with great discipline and intellectual rigour and being extraordinarily strong and persevering.
Today, within CSL, R&D is a truly global pursuit. $500 million are invested annually into the research of 1,100 scientists. Each project begins with an unmet medical need, or in layman's terms, a patient who is suffering.
It helps us initiate our projects, and I guess it sustains us through the many years it takes to really understand the disease process, think about how you might develop a drug, discover and develop that drug, get it through the clinical trial process and get it onto market.
Central to the mission are symbiotic relationships with universities, hospitals, and research institutes. To this end, CSL is a valued member of world-renowned medical precincts in Melbourne and Boston.
So there's only so much that you can do within a company. We look outside all the time for other ideas that are out there. And thus being in this Cambridge area allows you to make those connections. MIT is right down the block, Harvard's down the block the other direction. You have the academics meeting with the folks in industry and coming up with new and interesting ideas.
The headquarters of the company is in Parkville, has been for 100 years, and it's just a wonderful thing to be at the heart of one of the great hubs of academic medical research in the world. And our intention is to be the industry partner of choice for people in that precinct.
Certainly in the Australian context, CSL really is a unique organisation. It's one of the few organisations that has the capital and the know-how to take a discovery from the bench through to clinical trial in humans.
I was surfing off Bondi and just paddling out, I just suddenly felt that I was really wonky. I just suddenly felt a really violent hit right in the solar plexus, right there, bang. And it just kept going bang, bang. And I thought, I'm having a heart attack.
You pull up to the hospital and you hear this thundering sound, and that's the sound often of the helicopter landing right on the building above you. You know the patient in that helicopter is your patient coming straight from that helicopter, straight onto the table where you're going to try and get their artery open.
These aren't angels, they're nurses, so I'm alive. So, I knew I'd obviously made it through it.
You just dodged a bullet. Your heart is injured. It's not pumping as well. You still face an 8 to 10% risk of having a second heart attack.
When I had my second event, I was doing the same thing. I was out surfing again and feeling good.
Your heart's pumping ability goes way down with that second heart attack.
I was doing all the right things not to have had one. The third one I know nothing about. My heart just stopped.
What CSL 112 is designed to do is to treat those patients subsequent to their first cardiovascular event and prevent them from having that follow-on event.
To date, what we've tried to do is focus on the bad cholesterol. This is the first time we're giving real, human, good cholesterol to people to see if we can reverse heart disease, and that's why it's so exciting.
It'll be another huge product out of plasma. It'll be a product that we hopefully can purify from every litre of plasma that we collect, and that's really important to the economics of the business.
Today, we would discard the material that is the basic material that goes into creating CSL 112. Instead of doing that, we would create a
multi-billion-dollar product.
We've enrolled over 1,000 patients in a phase 2 study to look at the tolerability and safety of infusing the drug.
We will be, of course, looking at the data coming out of that study and making plans for doing phase 3 in that project, which would be the biggest R&D undertaking we've ever contemplated. There's risk in every aspect of R&D.
All the things that we do that succeed, there's many more that fail.
There's always risks, but I think you have to believe.
When something doesn't work, you try to figure out why it didn't work, and then you go on and make it again and make it better. That's a normal process for a scientist every day.
But it's not just R&D that's fueling CSL's growth. Swelling middle classes throughout the developing world are creating a demand for biotherapies, and CSL is expanding its commercial presence in these regions.
Brian and the team put together a phenomenal portfolio of science and projects from an R&D perspective. But now it's time to really take it to the next level in terms of commercial expanse, geographic dispersion, awareness and diagnosis of disease, the education that has to go on in the marketplaces. What we're doing is really saving and extending the lives of patients around the world that would not have access to these therapies if we weren't here.
China got the dream by 2020. They want to be a middle social class country. That means more than 70% of the Chinese population will be middle social class. With the economic growth, as well as the education level keep going up, with the information technology, the patient awareness of the disease, the patient awareness of the treatment has been raised a lot. So the biotherapies or the pharmaceutical market has been growing significantly.
To supply this burgeoning demand, an enormous investment is being made in infrastructure. Major projects in Kankakee, Bern, Broadmeadows and Lengnau are boosting manufacturing capacity, while new plasma collection centres are opening in North America and Europe. And to provide continuity and stability through this massive expansion, the best and brightest people are being developed to realise their potential as leaders.
I originally joined CSL on a 3-month contract, sitting on the flu manufacturing line, pressing the button so that we didn't harvest the green egg. There was another short-term contract open up, so I went over to one of the labs and started washing bottles. Because I was in the lab, I became very interested in the lab work. My boss at the time said, if you really like this and you want to make a career of it, you really need to go back to university. So with CSL's support, I embarked on a university degree. That took me 9 years. I was the first of our family to finish a degree. So my current role is the Head of Global Commercial Development. We have people here in Marburg, we have people in Bern, as well as the team based in the King of Prussia office. I love the long hours, I even love the glamorous travel. CSL is an exciting place and it's continuing to grow, and I just don't know what tomorrow might bring.
We have a desire to deliver the fruits, say, of biotechnology to many more people around the world, not just wealthy people in first world countries. And at the same time, there are strong trends to personalised medicines, better using genetic information in both broad public health and individual patient health, I think will be a theme for the next 50 years.
As CSL sets course for a second century, it does so with a reputation for world-class production, enviable financial strength, and a pipeline of life-saving and life-enhancing new therapies. Reflecting on 100 years of survival, healing, and heroics, one can marvel at the ability of this organization to become the visions articulated by its leaders. Firstly, as a government agency, tasked with defense of the nation's health, and then as a private enterprise, challenged to earn a place in the ruthless global market. On the production line, in the lab, and in the boardroom, CSL is driven by an irrepressible curiosity and a defiant determination to alleviate suffering. It is the promise to save and protect life that connects the generations and enables the integration of new organizations as it transcends language, culture, and currency. Indeed, it is at the very essence of what it is to be human. CSL's staff are custodians of an epic legacy, and it's now their time to write their own history, contributing meaningfully and memorably to this great, unfolding story.